I would now like to introduce QCGN President Marlene Jennings to make introductory remarks.
Thank you, Sylvia. Good afternoon, everyone, and thank you so much for participating in QCGN's Town Hall on the newly proposed PAC Provincial Advisory Committee regulations. We're lucky that we have a Health and Social Services Committee made up of a number of people and chaired by Eric Maldoff, who know the health system very, very well, who have great experience on it, on the legal side, but on the health side, how things go out. And that committee has helped QCGN establish a position on these proposed new PAC regulations, which we have already informed the minister of our position last August the 13th. What we're doing now is we're reaching out to give our position and why we've arrived at that position. And we're hoping that it will be endorsed by our member organizations and by health and social services stakeholders in the English-speaking communities of Quebec. And with that, I'm going to turn it over to our very able chair of the Health and Social Services Committee, Eric Maldoff. Eric, over to you.
Thank you very much, Marlene. It's a pleasure to be with you. I'd be even more pleased if the topic was somewhat different, but it's important we discuss this, find a way to get the community to know what is happening, because that's the first step to hopefully trying to intervene in a way that ensures that we can, or that helps protect our right to health and social services in the English language. As Marlene Nasler, who has spent many years working on the social services and youth protection side of the system, and who's on the Montreal Regional Access Committee. Marilyn Kaplow, who is a senior manager at the Royal Victoria Hospital and then the MUHC, and responsible for risk and safety matters. Richard Walling, who is heading up the Jeffrey Hale in Quebec City and has been very involved with us over the years. Dr. David Morris, who's a physician at the Montreal General Hospital and a member of the Provincial Access Committee. Jerry Cutting, who was the head of the Townshippers Association and many other things. And Sarah Saber, who is on the Provincial Committee. And has worked at the Agence in Montreal and Health and Social Services, and get into all of that, but has deep experience in the area and is very smart. I come to this as someone who has been deeply involved in health and social services for many, many years. I negotiated the amendments to Bill 10 that strengthened access programs under that legislation by including the human resource component. And then with a number of people I just mentioned to you, we negotiated with Dr. Barrett amendments to the Provincial Committee, or effectively a rewrite, which came into effect in 2018. And it's that regulation that is the subject of discussion now. Going back over the history of it to set the context, the right to health and social services in the English language was established in law in 1986. It was a clear recognition by the government that communication is absolutely essential to quality and safety in the delivery of health and social services. Very deliberately, the right is extended to English-speaking persons, not English mother tongue people, not English access to education people, not English first language people, because in the discussions at the time by the minister, the concern was some people feel more comfortable or more capable of communicating their needs and understanding information in the English language. And again, communications was at the center of this. There was a debate at the time where certain political parties tried to argue that the health and social service system should be used as a means of social integration. That was rejected when the amendment to the Health and Social Services Act was adopted in 1986. And for good reason. Many of you probably will remember Lucien Bouchard at one point saying, when you go to the hospital, you're not going for a language test, you're going for a blood test. And I think that sums it up. And I think he had a certain intimate familiarity with an encounter with the health and social service system, so knows what it means to be in a situation where you really need help. So that came in 86. The elements that came in with it were the right established in Section 15, Section 348, and the right was established as being a right to health and social services, taking into account the resources that are available for delivery of health and social services, which applies to the right to health and social services generally, not just for English-speaking people. But in addition, it's to the extent that those services are laid out in an access program, which at the time, every agence, agency for health and social, regional agency for health and social services had to develop an access program, which the minister had to approve. And the services that were identified in the access program were services to which you had a right to service. The third amendment that came in 86 was the recognition of our bilingual institutions, which are under 29.1 of Bill 101 and Section 508 of the Health and Social Services Act recognized those institutions as being designated institutions to provide all of their services and to be able to function in the English language. So that was the start of the right to health and social services. Why did we have access programs? It would have been nice just to have a pure right. The fact of the matter is that the system was not equipped at the time to be able to guarantee everybody health and social services wherever they showed up. And the government was most concerned about creating unrealistic expectations. So the idea was that access programs would be a developmental project for being able to develop the services that are sorely missing as in East End Montreal, for example, or in regions outside of Quebec, where there's a dearth of certain services. And the idea was that access programs would begin to identify what services were available. If the service wasn't available in the region, then it was understood that there would be service agreements entered into between that regional health agency and another one to ensure that English-speaking people were able to get transferred to get the services they need. So that's the origin of access programs. The quality of our right to health and social services depends on the quality of the access program of each region. In 1991, the Health and Social Services Act was amended again, and this time it added the creation of a Provincial Access Committee and regional access committees. And these were to be committees emanating from the community, appointed by the ministry and the minister in the case of the provincial committee, and appointed by the agence, the regional agencies in the case of the regional access committees. People emanating from the community whose job was to review the access programs, look at their sufficiency, and advise the regional agency or the minister, as the case may be, as to whether they recommend the adoption of the access program as presented, or to make recommendations as to other things that were needed. By 1991, there was a right to health and social services, which depended entirely on the quality of an access program, and an access program depended entirely on the quality of the Regional Access Committee and the Provincial Access Committee. As time moved along, the system was working, not without its difficulties, not without a fair amount of unevenness. Then along came Dr. Barrett in 2014 and decided to radically restructure the health and social service system, and took 182 institutions and amalgamated them or regrouped them into 34 remaining public institutions. This meant that there were fewer boards of directors to be responsive to the community, because those boards were now lesser in number. And it was the minister who effectively appoints those boards. Unlike before Bill 10, a majority of the board members were actually elector appointed, or in some manner got on the board by virtue of community and stakeholder involvement. Furthermore, another major change in Bill 10 was the CEOs of the remaining institutions were hired directly by the government by order in council, or decree as they call it, and no longer hired by the board, and therefore no longer really accountable to the boards of directors. This caused us to think that it was necessary to redo the regulation for the Provincial Access Committee, with a view to strengthening the committee as a means of ensuring community input into the question of access to health and social services in the English language. And a corollary to that was strengthening the regional access committees so that they would be looking after those needs. We would also mention that there were supposed to be, and are, advisory committees who were supposed to be advising various institutions on measures to protect linguistic, cultural, historic characteristics. And that's working to some extent. Barrett agreed to reopen the regulation. At that point in time, what we had found was the committee had come to be quite dominated by the ministry bureaucracy. The secretary, who was a ministry senior official, played a very major role. And the committee itself was constrained in its ability to consult and communicate with the community in virtue of certain government policies, which hand this over to certain internal agencies of the government to control all communications. We negotiated this, and the new regulations, I said, came into effect in 2018. And what we achieved there was that the members of the Provincial Access Committee, would essentially be people who were recruited through QCGN and CHSSN as province-wide organizations concerned with health and social services. Jointly, they would do the call for nominations. They would decide what media were used in order to publicize the call for nominations. They would establish with the minister a nominations committee. And the nominations committee, which was of the community and by the community, would recommend a list of people to the minister from which he would choose the members of the provincial committee. So that was a key measure. Furthermore, the committee was given explicit authority to consult and to communicate, it being understood that for the committee to be effective, communication has to be a two-way street. They have to be able to share what the committee knows, and at the same time, the community has to share what its experiences are, and we have to be able to work together. And furthermore, the provincial committee should have been in a position to play a leadership role, which the minister recognized that it would, in terms of the provincial committees and ensuring that there was coherence and a learning experience for all as to what the implications of the radically restructured health and social system were for access to health and social services in the English language. The minister recognized that. The committee was given those authorities. An excellent committee was created, Provincial Committee, with whom I can tell you the Montreal Committee, which is responsible for 10 access programs, was able to collaborate. And I can say that Sarah Saber on that committee and Sheila Murphy and Terry Kaufman have put in enormous time and enormous effort and have been terrific partners in working on the development of access programs, all as volunteers. The access programs currently in place are 10 years old. A lot has changed, not the least of which is Bill 10, restructuring the system. But needs have changed and a whole number of things, demographics have changed. The committee has done its work and has done a review of 29 access programs. It has delivered its opinions to now I'm talking about the Provincial Committee, to the minister. And the next step is for the minister to review them. And if past practice prevails, to come back and have a discussion with the committee regarding their recommendations before making a final decision to approve the plans with or without amendment. Suddenly, on the 30th of June, without any notice whatsoever, the government or consultation or discussion or a hint of there being a problem, the ministry caused the amended regulation to be published in the Quebec Official Gazette. That regulation takes effect. There's a 45-day period for consultation, which has expired. You note that this is just as the summer vacation period began. There were 45 days for people to get their comments in, following which the minister at any time can decide what the final regulation should be. And if it's published or when it's published in the Quebec Official Gazette, it becomes the new regulation. The new regulation is very disturbing, and now I will give a totally personal opinion that nobody else is responsible for. In my judgment, these amendments were for the convenience of the ministry, because they had a very, very highly qualified, dedicated committee that was not simply rolling over and was insisting on getting information and studies and evaluations of certain programs that were in place in order to create good advice for the government. This, I don't think, pleased the ministry officials who were involved in this process with them, because the committee was demanding, to be perfectly frank with you. So what did the regulation do? It basically has gone after everything that we had gained through what is the current regulation. Henceforth, there will be a selection committee of 3 people, all of which are selected by the minister. One will be the secretary of the Provincial Access Committee. One will be chosen from a former provincial committee or regional access committee, a former member of a provincial or regional access committee, at the choice of the minister. And the third will be someone who is an employee, which I found interesting, or a volunteer member of a provincial organization dedicated to defending the interests of the community in regard to health and social services. The minister being free to choose what organizations that is, and being free to choose what individual that is. And nothing that what I've said right now is inaccurate, and nothing in that regulation would indicate to the contrary. So the minister gets to put in place his own committee. He does the publication, he does the call for expressions of interest, and he makes the decision. The selection committee does not make recommendations, unlike the current regulation. This selection committee merely certifies whether a list of candidates are qualified to serve. And then the minister can go ahead with this decision, and from what I can see, is not necessarily bound to that list even. So another change that has taken place is the question of representation. There are 11 people on the committee right now. There would continue to be 11 committee, except under the new regulation, the secretary becomes a member of the committee as opposed to a support person for the committee. So he's a member, or she's a member, without a right to vote, which the right to vote, as you know, in the real world is not the most consequential thing in these kinds of systems. So it's now 12 members, 11 of whom are voting. And Montreal, which had 3 members, has been reduced to 2. Now, that might sound like Montreal being crybabies to raise this issue, but the fact of the matter is Montreal represents 50% of the English-speaking population of Quebec. Montreal Regional Health serves an even larger proportion when one takes into account super regional mandates of institutions plus adjacencies, adjacent regions. Plus Montreal has enormous diversity. And the differential impact, for example, of COVID in the early stages is a pretty good indication of the need for some greater sensitivity to the diversity of needs of English-speaking persons who may wish to have their services in the English language. So Montreal is down to 2. I have no idea whether we're going to take tall people versus short people, or East versus West, or ethnic versus pure land. Goodness knows. But that change has been proposed. Communications are now entirely controlled by the minister. He will establish a communications policy, and all communications are explicitly under the control of the secretary of the committee. Furthermore, they've now brought in a code of ethics and conduct. And amongst this, they've strengthened confidentiality provisions. And this code provides for the possibility of terminating a member if it is determined that they have breached the code of ethics. And guess who supervises the code of ethics? The secretary. So the secretary, who in current times is there to support the committee, has now become less a support and much more of a controlling power on the committee. And that is a government official. If that wasn't enough, they've limited the subject matters to which the committee can consult. Only to a formal opinion is to offer, whereas the mandate had been broadened under the current regulation to be able to advise on changes to the regulation, which the government has not done, changes to legislation, changes to policies, all things that could impact access. The committee would have a mandate. Well, they're not entitled to communicate on that broader mandate from what I can see, and what we can see. And last but not least, the access programs have not yet been adopted, not yet been approved. They're still 10 years old. We're finishing the first cycle of renewal after 10 years. And this pops up in the Quebec Official Gazette. And the last provision in that regulation is that all the members of the current committee, regardless of the fact that there's still time left on their terms of appointment, will terminate on the date of the coming into force of the regulation, which is the date on which it gets published in final form in the Quebec Official Gazette, which is entirely in the minister's discretion. And at that point, we will not have a Provincial Access Committee. The new process would have to be followed to install a new committee, but that process is not legally in place until the amendment proposed to the Provincial Committee regulation takes effect. So in other words, on the day the regulation takes effect, the committee is gone, the actual one, which by the way means there's no committee to speak up on Bill 96, which it is studied intensively. There's no committee, and has huge ramifications for us, and no committee to speak up on the access programs or the fact that they aren't even approved yet. No committee. And when and if there is one, and I assume there will be a gap for some period of time, this will be a committee that is completely captive of the minister. So in terms of a committee that is of the community with a reasonable degree of independence, with a power to communicate and to look to our interests in an authentic and credible way, this regulatory amendment would put an end to that. Does it matter? I leave that to you to judge, but since the right to health and social services depends on access programs, and therefore depends on the quality of those programs, and the quality of those programs depends on the quality of the access committees, I think it does matter a whole lot. When you tie this in with Bill 10, which I won't go on at length, but people should be aware, Bill 10 says that in the public administration, which includes the entire health and social service system, the rule is the exemplary use of French, which means the exclusive use of French orally and in writing. The bill does not provide for a right to health and social services in English. The bill does not create a right to certain services in English. The best it does is it creates an option in favor of the bureaucracy as to whether they will exercise that option to provide services in a language other than French in very limited number of circumstances, such as if you are eligible for access for English instruction in Quebec, which to take the English instruction test and apply it to health and social services, which is about people being able to communicate, makes no sense whatsoever and is a reduction of the rights of the community, notwithstanding what the government might be saying. Furthermore, any institution that has to release a public annual report has to state in that report the number of positions which require require a knowledge of a language or a specific level of knowledge of a language other than French, which is simply inviting this to become a political issue and an issue where the office, the langue française, etc., will be all over it, as well as certain advocacy groups. The law is also very clear for non-29.1 bilingual institutions. They fall under the general rules. And the general rules are that the ministry is going to create a directive, the Ministry of Health and Social Services, that outlines the situations in which the English language, knowledge of the English language may be required. The ministry does this, not the institutions. How there's going to be an interface with the institutions to get that right, I don't know. But the directive also requires that there be an identification of all of those situations, which has to be approved by the government. And think of what that means for a cash-strapped centre intégré that has an English-speaking population and gets a 30-page questionnaire telling it to go through its entire staff and identify and justify every situation in which a knowledge of a language other than French is required. I want to assure you that the average bureaucrat will not find that to be of great interest, nor will he find that he has the budget to spare to do it. Lastly, even in the case of bilingual institutions, the rule is now, if, and this is for all institutions, including bilingual ones, if you want to require, if that institution wants to require a knowledge of a language or a level of knowledge of a language other than French, first they have to do a study that demonstrates that there is a need for this. Two, they have to be able to demonstrate that nobody else could fill in for that need in a sufficient manner. In other words, some other nurse or physio on the floor may be able to speak English if they happen to be on shift or whatever. And lastly, if the two first conditions are met, then on top of that, they are told they are to restrict doing this to the maximum extent possible, as is the case with the options to use language other than French under the exemplary provision, which dictates very clearly in 13.2, you can read it, that they are not to make systematic use of the English language. So those are a few of the things you should be aware that are at play because of what's happening with this regulation. And the voice has been silenced or would be silenced. I think the community has to stand up, and we have to start to come together around our needs. And I think any suggestion that this won't reduce rights is serious and wrong. At a minimum, the government is going to have to say that very clearly 96 does not impact the right of health and social services as set out in the Health and Social Services Act and the entitlement to all of the measures to be able to have access to those services. That is not the case right now in the way this is written. And Bill 96 basically says that all other legislation should be interpreted consistent with the intentions of Bill 96. That being said, I thank you for listening to me and for your attention. I hope you found it helpful, and I'm more than happy to answer your question.
Thank you, Eric. When we sent out the invitation, we sent you a copy in French and in English of the letter that QCGN had sent to Minister Dubé that was fully endorsed by our board, the position that Eric's committee had taken. So you have that letter. If today you don't, after this meeting, you feel that you can't find it, don't, let us know and we'll send it to you again. Right now, we have about 20 minutes for questions. How about I take questions? I'm not seeing any hands up, and I don't see anything in the chat, but I'm
Jerry put his hand up. Yeah.
Jerry.
Everybody left.
No, I think everyone's ruminating over the information you've just provided, which is serious and requires real grasping of what you've said. Go ahead. Sorry.
Okay. This is not really a question. This is a comment. Is that Townshippers Association has already, through the use of email voting, endorsed the policies put forward. And to thank also Eric for his contributions here. And I think what it has to come down to is that we have to have, in terms of moving forward, we have to have that commitment from the community in general, through its associations, so those are individuals who can see what's happening. There's one thing that Eric did not comment on, and it is in 96, that is the creation of a ministry specifically for the French language, and a commissaire who will be in charge essentially of enforcement. That means that effectively after 96, the most powerful minister in the government will be the Minister of French, because in many instances, nothing can be passed without the approval of the Ministry of French. And then the commissioner has powers that are scary. And I think we have to be well prepared to see that what's happening here with this regulation, it opens the door once 96 is passed to move in quickly. And I think what we know from this government is that consultation really doesn't hold much unless you're supporting the government. It's going to be a long, tough fight, but if we don't, we are going to lose enormous. And notice something else. In Bill 96, and whenever we're talking about regulations, it's a language other than French, a complete negation of the status of the English community as a dynamic part of Quebec society. And what we need to have is that official recognition that we, in fact, are valuable members. We're not just some community that, oh, again, them. But I think I can go on and on. I don't want to, because probably a lot of other people have things to say and maybe questions too.
Marlene, I saw your hand up and I also see Sheila's. Marlene, your hand is down? Sheila, I saw your hand up.
Yes, thank you. So for those of you that don't know me, I'm Sheila Murphy. I'm the current president of the Provincial Access or Advisory Committee. And just I wanted to thank QCGN for this opportunity to collect the community together and talk about the regulations. And yes, the period of comment has ended, but that doesn't mean that advocacy cannot still occur. I did want to let folks know what the provincial committee has done. So we sent in our own letter, of course. We also sent in an opinion on Bill 96. We did all of this before the 15th of August, and just in case the timing of the tabling of revised regulation continues versus what we know QCGN, ourselves, and perhaps others have asked for, which is just don't do it at this time, allow the plans to move forward. And then once there's into implementation phase, let's have a conversation with the community about how to improve the work of that committee and around access. So, and we have tabled as well into minutes a number of other items, including annual reports, so that there's a written record of what we tried to do. The only other thing I will say that Eric didn't mention, but it's in the QCGN letter, is that the minister also chooses the president and the vice president of the committee, and that is troubling for based on the experience that I've had being on that committee a couple of times. It is really important that the committee itself chooses its leadership and has confidence in who they select as president and vice president. And some of this is about leadership experience for sure, but some of it is also about people's ability to devote time to the effort. And I'll have to say that certainly there's a few of us on the committee for the last 3 years have devoted a huge amount of time to try and have a conversation and provide the minister with, well-researched, rigorous advice that we hoped would advance the access to health and social services in English. So I just wanted to say thank you for QCGN, and I see that there's other comments about what's next, and I think that's an important thing to cover off and turn it back over to others. Thanks.
Thank you, Sheila. I see from Lily a comment. Please use your local newspapers to register opinion on this, letters to the editor. Certainly that's part of the campaign for advocacy. There's a question for Jerry. What kind of publicity are you looking for? I'm in the township, so maybe Jerry, you could just address that for a second. I'm sure it will be good for others as well.
Well, in terms of publicity, we're looking to the Sherbrooke Record as one, and what I think must also strongly consider is that we need to get into the French press, so we will be trying to get into that Tribune. And the Townshippers Association has a website, and I think we have to be very, very conscious that there is a generational issue here, that many younger people, and just about everybody's younger than me now, tend to go to social media. And that also has to be a very important part of our messaging. And what we have to be able to do is also package the material in ways in which people can understand it, and understand it in a way because they could see in the future what happens to me if I walk in and say something that is not in French, and as a request for services in English, and you're told because the word on the working floor is ici on parle français. And I think what it comes down to is that if you can get across the message that people can see that it could affect me when I'm in crisis, at a time when I need to be able to express myself and my needs clearly and distinctly. So first of all, we will use the media at our disposal because we have control of our own website. We're going to try and do the utmost there.
Well, thank you, Jerry. Your website and the work you're doing at Townshippers is really quite wonderful. I have Dr. Fuchs. Eric, I don't know if you come before Dr. Fuchs or not. So how about if I give Dr. Fuchs the hand right now?
Thank you very much. Hi, Eric. Thank you for a very detailed and clear overview. You alluded to two potential motivations on the part of the government. One has to do with the entire Bill 96 story, which is French language and that broad initiative, sort of social, cultural, linguistic. And a second one is clipping the wings of the Provincial Access Committee and the programs. They may be overlapping, but they're not identical. In other words, even if Bill 96 goes away, destroying the provincial access system would itself be hugely detrimental to the quality of care. And I think we need to be able to make both arguments. It isn't solely a linguistic argument. There's an argument here of quality of life independent of the Bill 96, but being a patient in Quebec and getting care. So we talk a lot now about the rights to have a vaccine or not have a vaccine. Without entering into that debate, surely there is a basic right in our province to have access to health care that is appropriate because the lines of communication are appropriate and clear to the need.
Thank you, Dr. Fuchs. Eric, would you like to comment on that? I also have Sandra Delaronde, Dr. Delaronde as well. Eric, would you like to comment?
I would offer this comment. First of all, my apologies to Sheila and Jerry for not mentioning the omission, the things that I omitted. And you're absolutely right with your comments. And both are very important. The power of the minister, not only equipped with the legislative power but and regulatory power, but with his own police force to enforce this with an augmented budget. And certainly the quality of the president and vice president of the committee is critical. And Sheila's done a fantastic job on this, as have a number of others that I mentioned before. I think Abe has got it exactly right. And maybe I should not have done what I did today in terms of explaining how one will tie into the other, but on the other hand, it is significant that these are happening at the same time. On the other hand, I think it's a big mistake if we get into health becoming a language issue. Health is about health. And we've got to start to speak in those terms on the right to quality and safe and appropriate health and social services. And this is outside the scope of whatever linguistic debates the government wants to have about the education system or immigration or anything else. And that line has to be told very hard. Otherwise, we get dragged into all the zealots coming out on a language issue.
Thank you, Eric. Sandra?
One of the things that I was thinking about when you were talking is, and if it hasn't been thought of already as allies, are the mental health organizations. The government's just also pledged to have this committee or special group on domestic and sexual violence. And while physical illnesses also have nuances in each language that it makes it easier, especially when you're in crisis and pain, emergency situation, to be able to communicate in your most comfortable language. I think that mental health issues and social health issues are even more, because there's nuances, especially in English, in somebody who having a mental health crisis that may be very different from what happens in French. And it's you have to have somebody that understands the sort of hidden messages that the patient's trying to give you. And so I think that it doesn't need to just be Anglophone or English-speaking health or mental health organizations. I think you can enlist the assistance of whatever language mental health organization, because it's in some ways a very unique need.
Thank you, Sandra. Eric, a comment? Is that a hand now or from before?
No, it's a hand now. I think that's a fantastic point, really important. Language is absolutely indispensable in the mental health sector and in the social services also. And I would remind us, we have an aging population, and with the passage of time, this is well known, calling upon seniors to be communicating on sensitive matters in a second language, often they lose their facility in a second language. So this is really a very serious issue, particularly for many of us who have aging parents.
There's a question in the chat. Did we get a response from the minister about our letter? No. We did not. The QCGN did not. We got an accusé de réception, but I think we want beyond that. I don't know if the PAC got an answer. Sheila, did you get an answer from the minister?
No, but I mean, it's only been a number of days. I'm not surprised. I think they're probably taking in whatever they received and doing some analysis before they decide their next steps. So I'm not surprised. I mean, if it had been a month since the submission, then you'd start to get a little more concerned, but no, we haven't.
Thank you. Are there any other questions with hands up or in the chat? We have a couple more minutes. How can we make this an issue in the election at all levels? This is Fred Jansen. Marlene, I figure you're looking as if you want to have your hand up there.
I do.
Oh, Eric does as well.
Go ahead, Eric. Go ahead, Eric.
Yeah, I think it should be an issue at both levels, because the federal government has come out with legislation that would, let us say, not providing the speaking Quebecers with the same employment opportunities and the same level of access to services as others who benefit from the Official Languages Act. And furthermore, the current Prime Minister has been very quick to say he likes the idea of this, or can live with the idea of a constitutional amendment as proposed in Bill 96. So I think there are some questions to go. Does this mean you endorse this, sir? And various questions of importance to us and our community. I think he's getting a free ride. And I think at the provincial level, when I listened to the latest spokesman talking about, well, we'll have to find a compromise. I don't know what the compromise is, quite frankly. And I should say that the position that we have taken on the provincial committee regulation is that it should be withdrawn at this time. We have not put up a bunch of points to start negotiating on. The issue is it's inappropriate not timely, not justified. And once we get through this cycle of renewing the access programs, then we can sit down in serenity and have a discussion of what's working, what's not working, what can be fine-tuned, whatever it is. But at this point, that regulation is a distraction from getting what we need, because there's no right without an access program that's approved.
Thank you, Eric.
Just to add on a bit to what Eric said about the federal parties getting a free ride so far in their election campaign on this entire issue. They have been. QCGN has sent a letter to the leaders of all of the federal parties and all of the candidates who have been identified to date, who are actually official to date, on the issue of Bill 96 and the impact that Bill 96, if it goes forward as is or at all, that it will have for not just the English-speaking minority communities of Quebec, but Francophone communities outside of Quebec as well. And we have a list of questions that we ask them to take a position on. What is their position on this issue, that issue, that issue? That letter has been made public. You can contact QCGN, go on our website to get a copy. And in terms of the PAC itself, but also Bill 96 and the federal elections, one of the things that QCGN is asking, and that's why we've held this town hall, is that if you agree with the position QCGN has taken on the PAC regulations, as Eric has just explained, and as the letter to Dubé clearly describes, please endorse it publicly, 1. 2, contact your local MNA, regardless of which political party they represent, and express your dissatisfaction, your opposition to the proposed new PAC regulations, and demand that the current PAC regulations continue to operate and allow the PAC committee, as it is now constituted, to continue the work, important work that it's doing. Write to Minister Dubé, write to Premier Legault, write to Christopher Skeet, who's supposedly our voice in the Legault government, and tell them that you do not agree with these new PAC regulations, that you endorse QCGN's position that these new PAC regulations simply be withdrawn. And in terms of the federal, as I said, the questions that QCGN has asked of all of the political parties and all of their candidates are questions that you should be asking when you know, if you know who your candidate is. And that's regardless if it's a Liberal, a Conservative, an NDP, and yes, even a Bloc, because there are Bloc members who have significant English-speaking people residing in their ridings. And whether they vote for the Bloc or not, once someone is elected, they are there to represent every citizen, every resident within their riding. And if they don't do that, then they're not fulfilling their mandate and their responsibility. So basically, that's the goal of this town hall. We want to get you guys mobilized along with the mobilization that QCGN has been doing, and get the word out and get your opposition to the PAC regulations and yes to Bill 96. And talking about Bill 96, QCGN will be conducting public consultations on Bill 96. We've already issued a plethora of invitations across the board, not just to organizations and individuals of our community, but also of the Francophone community, different sectors. And those consultations will be happening in September before the National Assembly Commissions begins its own public consultations. So, and thank you all very much. A big thank you to Eric for yet again providing such a clear, concise, but in-depth analysis of the PAC regulations and how they fit with Bill 96. And thank you to all of the members of our Health and Social Services Committee for your contribution to the position that QCGN has taken. Thank you to all of the participants, and any questions you have, any documents you might need, just contact QCGN either through the website, or if you have a contact inside directly, do that. We'll be happy to provide you with any support we can. Thank you.